Black History Month is over with, but health advocates are urging families to not just honor legacy, but to protect it. By 2030, in less than 4 years, Alzheimer's is expected to affect nearly 40% of Blacks and Latinos in the US. Yet nobody's talking about it. While Alzheimer's doesn't see color, its impact is not felt equally. Early conversations about brain health and memory issues can lead to better outcomes, and there is an initiative designed to help. Today, it's called Owls in Color, if I'm saying it right. Owls in Color. Today, I have dementia care expert Dr. Epps. Good morning, Dr. Epps. How are you?
I'm doing good.
So, the numbers surrounding Alzheimer's rates are pretty jarring, yet, this is a topic that many minority families avoid discussing. Why is that? Because I know what happens in my family.
Yeah, well, I think one of the things is we don't realize how alarming these statistics are and how it is really attacking our communities of color and that this is a public health crisis. I wasn't aware, say 10 years ago, I didn't know Alzheimer's disease was twice more likely to impact Black Americans in comparison to our white counterparts, and Latinos is 1.5 times. I was unaware of that, and so not knowing that, I couldn't have those conversations. So I think it's very important that we get this information out to our communities, and that's not happening all over. And so we need to do a better job at that. Also, in these communities, they don't have access, great access to resources and supportive programming. And so when that's not happening, they're not going to talk about it. And so maybe they just avoid that. So at Alls in Color, we are here to try to change that narrative. We want to make sure that these communities have the resources that they need so they can start having these conversations and having them early.
Now, even as we've already celebrated Black History Month, conversations around memory loss and Alzheimer's should continue among communities of color. Why is it important, especially for women, to have these conversations?
Yeah, we need to keep talking about this, y'all. And even though Alzheimer's disease and dementia does not discriminate race, age, or gender, but women are more impacted because many times they have caregiving roles. And with that, they are actually managing the health of not just that person living with dementia. Many women are managing the health of the entire family. They're the CEOs of the health of the family. And we want to make sure that they have the resources that they need so they can initiate the conversations early at the kitchen table, in the community, in church or whatever organization they participate in. We want to make sure they have the resources for that.
Now, doctor, what steps can people take before symptoms appear, and what are some early signs?
Yeah, so I just want to make sure everyone knows that things start occurring, changes in your brain start occurring up to 20 years before you actually see the signs and symptoms. So that means we need to start taking action now. So, brain health is so important, and some things that you can do. The US Pointer study put out a brain health recipe. Um, but one of those things is making sure that you have a proper diet. So, eating right, what's good for your heart is good for your brain. Exercising, getting rest. So, sleeping maybe 7 to 9 hours a night is so important. Uh, Engaging your brain, challenging your brain with activities and puzzles, and also reducing your stress and social engagement. Those are things that you can start doing now at any age that can help reduce your risk of dementia. And then you may say, you did ask, what are some early signs? And a few of those signs are, of course, forgetfulness, where you're unable to remember, misplacing items, and you're unable to retrace your steps. Changes in your personality, drastic changes. That's something that we often overlook, but a sweet person, always nice, now starting to curse and become aggressive. We need to pay attention to that. And not being able to complete familiar daily tasks, not being able to finish making your coffee. These are things that you want to share these concerns with your family and also your healthcare provider.
Now, tell us about the initiative and some of the resources available.
Yes, so Awesome Colors, a campaign focused on brain health conversations in Black and Latino communities. And it's focused on empowering these communities with authentic storytelling. So we have testimonies from families, individuals, and then we accept more families to share their testimony because sometimes when you see someone that looks like you going through this, you feel more empowered to take action. We have resources available like a brain health questionnaire that our families can download, and they can bring that to the doctor to help facilitate their conversations. And also, webinars, educational webinars are available. So, those are a few things.
Now, what's one piece of advice you would give a patient or family member just starting their Alzheimer's journey?
Yes, I know a diagnosis you may feel that may feel scared, may be devastating for a few. And then you may just sit there. But I want to ask you if you just starting this journey, please do not just sit there. You want to be proactive and start getting education. Educate yourself, your family, learn about the resources in your area again, so you can be proactive instead of reactive. And with being proactive, you can have a better quality of life while on this journey.
This is inspiring information. Now, where can we send our viewers who want to learn more?
Yes, please visit our website, AlzInColor.com, for more resources and information on supportive programming.
I've been speaking with Dr. Fayron Epps, dementia care expert and founder at Alter Dementia. Thank you so much for joining us and talking about Alls in Color. Thank you again.
Thank you.